Thank you, Governor. Good afternoon, everyone. I owed a follow-up from the last press conference. I said that influenza data showed that masks worked right here in Kentucky. So for the influenza season right before and at the very beginning of the COVID pandemic, 2019 to 2020, Kentucky had 27,408 confirmed influenza cases. And for the entire season before COVID, we had 165 influenza deaths. For 2020 to 2021, so the winter we have just concluded, when COVID was in its huge surge, we only had 186 confirmed influenza cases. So that's 27,408 the year before compared to 186 for the most recent year. We only had 2 known deaths from influenza last year. So the masks work, folks. I mean, there's a lot of other evidence too. This is just one data point. The problem is COVID is just more contagious and is an even more difficult infection. Can you show the one healthcare capacity slide with it? Thank you. This is my only image for today. COVID-19 ICU patients set a new all-time high yesterday for the entire pandemic. The governor's already shown some videos, testimonials from people who are actually at these hospitals. We're getting increasing numbers of facilities report severe strain and report that they are having to consider or are already implementing crisis-type levels of staffing and care changes. This means that folks, not just with COVID, but all folks who need help at the hospitals, whether that's for illness or injury, COVID or non-COVID, will start to see probably a deterioration of some of the care they get because they won't have the same amount of staff to provide care. This will impact everyone needing care, not just people with COVID. I need to ask you to be patient with these folks. I want to put this in context, particularly if you're going to the hospital for COVID care and you have chosen not to be vaccinated. You will be going to exhausted healthcare providers who are understaffed in providing care for you for a disease that was preventable largely because of the vaccinations. You need to be very patient with those folks because they are in a difficult situation with the distress that comes with providing care for large numbers of people, overwhelming healthcare capacity, seemingly because they were unwilling to get vaccinated. Please be patient and grateful for what they do, even if it doesn't happen in the timeliness and in the way you think you are entitled to. All of this is happening in the context of some members of society telling people to disregard public health guidance to get vaccinated, to wear masks, and to take other precautions. This creates division, confusion, and will cause not only loss of life, but also deep harms to the healthcare system that will not easily be repaired. Humpty Dumpty is falling off a 30-story building, and there is no parachute and there's no safety net. We're entering a time when people with and without COVID are going to get seriously hurt and may well die. So I have some specific action steps for you. If you have an emergency, go to the hospital and seek care. You shouldn't delay your care if you have an emergency. If, though, you do not have an emergency and you don't need to be at the hospital, I strongly advise you to not go to the hospital. And I do have confidence, just like the governor does, in our healthcare system and in our hospitals and in the clinicians that work there. But let me tell you, if you do not have to be in the hospital overnight for a stay, if you have a procedure or a surgery scheduled that you have to stay overnight in the hospital afterwards, and it can be safely postponed for a little time, if you were my family member, I would tell you to not go into a hospital now if you could avoid it. This is not the time to go in there because the experience may not be the same. So please consider that carefully. And finally, the governor's already touched on this. Do not go to an ER just to get a COVID test, period. Do not go to an ER just to get a COVID test. If you are sick, if you think you have an emergency, go to an ER. Do not go to an ER just to get a COVID test. Those folks are focusing in horrible conditions on trying to take care of really sick and injured people. And what will happen, and they can't say this, federal law requires that they evaluate you and provide care, but what they will do is triage you. You will sit in a waiting room for a very long time. And if you leave, you may well get a bill still for the triage, and you should, because a nurse and a qualified medical team had to evaluate you at the front end. If you need a test, go to a pharmacy, go some other location where you can get a test, but do not use the emergency department just for COVID testing. I'm going to talk about the COVID vaccine. Oh, one other thing about the health departments. The health departments are still actively monitoring the disease. They are actively advising and supporting persons and businesses and schools in their communities. But the public should not expect a phone call from a health department to confirm that you have a positive COVID test. You should not expect a phone call from the health department to talk to you specifically just about quarantine and things of that nature. If you're exposed, you should stay away from others. Quarantine is still useful. If you have a positive test or you have symptoms, do not go to work. Do not go to school. If you are sick, you should stay home until you are better, because people who are sick should not be out there spreading disease right now when I've just described the horrible situations unfolding in hospitals and, as the governor has shared, that are impacting younger people. But please, it is not the same as it was before. You're not going to be getting phone calls for every single positive test, and the public has to adjust its expectation of that, because the public health workforce is strained in its own way, just like the acute care clinical workforce. Now, with respect to the booster doses and third doses, they're not the same. Right now, the only persons eligible for a third dose of an mRNA vaccine, that's Pfizer or Moderna, are individuals with moderate to severe immunocompromised conditions. And we gave a list before on a slide. That information is now widely available. If you are one of those persons, you can go to a pharmacy, you can go to a health department if they're offering this, you can go to a clinic, you can get your third dose. Let me be very clear about this. Don't lie about this. They query the registry and they know how many doses you've had. And if you don't qualify for the indications, they won't give you that third dose generally, because they have to follow the emergency use authorization criteria, which specifically says the third dose is only allowed for people with immunocompromised conditions. Now, if you live in a nursing home, if you are a long-term care facility resident, I have written a letter and declared and deemed that all residents, all permanent residents of a long-term care nursing facility, a skilled nursing facility, are determined in Kentucky and deemed to have moderately to severe the compromised immune systems by virtue of the medical conditions that put them there, the frailty they generally have, and the high mortality rate that was experienced for much of the COVID pandemic. And that letter is being shared and is available, so pharmacies should feel free and should offer to all of those individuals who are inpatients or residents of a nursing home to give them that third dose. Now, the White House announced yesterday that it was going to proceed with trying to make available a third dose of mRNA vaccine to persons the week of September 20th. I want to there's the devil's in the details in this. That's September 20th. It's not now. That's 1 month from now. And it will be for people who have had their second dose 8 months or more before, which means not everybody's eligible. You have to have had 2 doses of Pfizer or Moderna, wait 8 months or more, and then you may be eligible for that third dose. The FDA and the CDC's Advisory Committee on Immunization Practices still have to review the data and make the necessary changes to make that happen. I am confident it is likely to happen, but we're talking a month from now. So please do not go and seek your third dose yet. You're not eligible. And when it is time, sometime in September, you have to have had 8 months pass. At least that's the guidance they've told us so far. My final thoughts here, for those of you who have listened and tried to do your very best to comply with the guidance we've given throughout the pandemic, thank you. You too are heroes. Your actions have kept you safer, kept others safer, and have really helped all of us and been an inspiration to others. I think you are heroes in your own right for taking these difficult steps to comply with these requirements and requests, which are clearly not the lives we used to know. For all of us, because society is succumbing to a sea of disinformation and persons in positions of influence are misleading the public, a tiny little virus is winning. The virus has been smarter than humanity. We could have snuffed this thing out, but instead it is snuffing us out, and we are tearing ourselves apart, arguing over things that should not be divisive. This too shall pass, but it will not go silently into the night. A lot of people are going to get hurt. I urge all of us to try, however hard it may be, to strive to be kind, caring, and considerate to each other. And for anyone willing to listen, please get vaccinated, wear a mask whenever you're near others, and take steps to keep yourself safe. Though we can't control the action of others, there are many steps we can take to keep ourselves and those we hold dear safe from the worst harms of this devilish virus that is causing so much harm. Thank you very much.